The following stretch we have on there is called the prone press up. So this is kind of for two different reasons. One, unless you have a contraindication, like maybe a spondylolisthesis or severe arthritis, I do like to try to incorporate at least a little bit of lumbar extension into most of my stretching programs. I think it's good for the spine to at least experience that extension moment some. But the other benefit of this stretch is that we're going to get a nice stretch on our rectus femoris, our abs, and our obliques in the front as well, on the sides and in the front. So we're going to lay on your stomach. And this one, it's kind of like doing a push-up, but you're going to leave your hips on the table. So we're just laying on your stomach and then pushing straight up. And when I really don't feel anything in my back. All I feel is a nice stretch along my belly. This one I wouldn't hold as long, so instead of holding this for 15 seconds, I might really try to hold for about 10 seconds on this one.
Why not do shorter?
It puts a little bit more stress on the lumbar spine when I'm holding it into extension. Flexion of the lumbar spine is a more comfortable position, so just to avoid any discomfort, I would maybe just hold that for about 10 seconds. This one, actually, when I do this one in the clinic even, sometimes I'll just do it for like 5 seconds, like have them press up, 5 seconds and back down. Press up for 5 seconds and back down.
Some people doing that with weights, hanging and doing it. Is that bad to do?
It depends what your goals are.
Right.
If your goals are to have a really defined muscular back, the weights probably help with that. If your goals are just to have a nice, healthy low back and provide lumbar posture and support, then there's really no need to do weighted.
I was just wondering if the young people are hurting themselves by doing that. I was just wondering.
Probably so. But they're going to have a really good looking back to show for it. No, it's really, if you're doing it safely and repeated, and a lot of times when you see them doing that at the gym, they're not actually going to extension. A lot of times they're in flexion and then coming back up to neutral, and that's really not as bad for the back. You are developing some really good core strength doing that. It just all depends on what your goals are. And for most of us during daily life, we don't need to do anything weighted like that to strengthen our core. It's more about repetition and prolonged holds than it is about really increasing the weight when you do core strengthening. Yeah.
I think I heard you say that was contraindicated for spondylolisthesis.
Yes. If you have a spondylolisthesis, I would not go into extension.
Thank you.
Mm-hmm. So the next one on here is, it's actually two different stretches, but I do this one as a repeated movement. So this is a little bit different than all the other ones that I've shown you so far. There's not going to be any hold time on this. You're just going to repeat this for 30 or 40 repetitions. So this is called, in my program that I print these out on calls this the cat camel. I call it a cat cow, whatever. Same thing. So you're going to be on your hands and knees on this one. And you're going to, first what you're going to do is you're going to arch your back down and bring your head up. And then you're going to round your back out and drop your head down. And I would just do this nice and slow with a little pause at the end of each movement. We're going to do this for 30 or 40 repetitions. Now, if you don't feel comfortable on your hands and knees but still want to do this exercise, I have patients do this in sitting all the time. So I'm just going to scoot to the edge of the chair. I'm going to cross my arms across my chest, and I'm going to slump down and drop my head, and I'm going to look up and over-exaggerate that upright posture and really get a nice curve in my back. And then slump down and over-exaggerate that upright posture. And then slump down. Now I want to make sure we're not leaning forward. It's not a lean forward, it's really just a slump, like you're sitting lazy. It might feel like your normal posture when you get there. And then nice and up tall.
So when the child's pose side bending, you don't want to do that slump then. You want to try to keep your back straight.
Your back straighter on that one, yes ma'am. Your back straighter. And just to back up a little bit, back to that extension one that you're still not going to do with the spondylolisthesis, but if you don't feel comfortable getting down on the ground and laying on your stomach, you can do that standing. It's not quite as effective, but you can simply put your hands on your hips and then lean back. Now what I like to do when I do that standing is I'll get like the edge of the sofa or a treatment table or a desk or something just to kind of rest my bottom on, and then I'll lean back like that. So I've got a little bit of support back there. And again, I'm not trying to go all the way back like a gymnast, just a little bit of extension there. But there is an alternative for that if you don't want to be laying on your stomach that you can do standing.
Are there advantages to, if you're young and have good balance, to doing that in a hot shower? Does that help at all?
Heat brings more circulation, more blood flow to that area, and it also makes things more pliable. And that's true of any structure, but in our body as well. So a hot shower will increase the circulation to a specific area, especially if that water's just running on your low back. And it may make those muscles a little bit more pliable, which may allow you to get a little bit more of a stretch. But I'll tell you what gets even more blood flow into the muscles and makes them even more pliable is a little bit of a warm-up. So yes, doing a stretch in a hot shower may help you get a little bit of a better stretch, but doing all these stretches after you do a little bit of a warm-up is even better.
Like cardiovascular something?
Yes, that's a great point. I'm really glad you brought that up. If I was going to do this program, I would not wake up, roll out of bed, and do this program. I would wake up, I would go for a 10-minute walk. It doesn't have to be extensive, just a warm-up. Go for a 5 to 10-minute walk, and then I would stretch. Or if I'm trying to organize how I'm going to exercise, and maybe I'm going to go for a jog and I'm going to stretch, or I'm going to go for a walk and I'm going to stretch, I would always do the stretching after the activity rather than before. That's one of those things when you're growing up, you start soccer practice and you start stretching first thing. That is not, we're really moving away from that. There always needs to be some kind of warm-up before you stretch. And in some cases, a hot shower or a hot pack or something like that can serve as the warm-up, but it's always better to do an active warm-up like a short walk or something like that first before you start stretching. Yes, sir.
One thing I could think of in a shower, if you're bending forward and then going back, and that blood flow hits you wrong, that shower's kind of slick.
Yeah, absolutely. There definitely are some safety issues there as well. Yeah, there's definitely some safety issues for sure.
I don't think I
For
would
sure.
do a shower first.
All right.
Dizziness too, I guess.
Yeah, that's what I mean.
Yes, ma'am.
Another thing we haven't really addressed, I used to do yoga, more unfortunately. One of the things was to take a breath and then when I exerted, let it out. Is that still considered to be good practice?
Yes. Yeah, there is. In fact, we do some yoga treatment in our clinic, and in that case, instead of having patients count to 10 or 15, we'll give them cues like 3 breaths or 4 breaths. And we do try to time the breaths. For instance, if we're going to be leaning forward, we'll exhale on the way down to release oxygen from our lungs to give us more mobility there, and we'll inhale on the way back up. The reason I don't usually put that in these types of stretching programs is because, one, it's challenging, and it really helps to have a yoga instructor or a therapist or someone who's done that before kind of guide you the first few times that you go through that, because the breathing and the stretching, it doesn't seem like that challenging. It's really challenging to sync that up appropriately. So I don't usually educate on that on these kind of seminars. And then the other thing as well is that it's not always exhale on the stretch and then inhale after the stretch. It varies based on that particular stretch. So I find that can get confusing sometimes as well. But if you know how to do that, I actually think that's a better way to do it. Is if you know how to sync your breaths and you're going to hold a stretch for 4 breaths, I prefer that to just counting to 15. Okay. The final stretch on this page is the supine lower trunk rotation. And this one may be a little challenging up here. I'm trying not to fall off here. So this one, you're just going to be lying on your back. And normally, I would have my arms out. So you have your arms out like this. Sorry if I'm in your way. Scoot up a little bit. And then I'm going to exhale. This one I actually am going to talk a little bit about breathing. So I'm going to exhale as I let my legs fall to the right, and then I'm going to turn my head to the left. And I'll hold this one for 10 to 15 seconds. And I'll bring my legs back up, straighten out my head, and then I'm going to go to the other side. Drop my legs to the left as I exhale, turn my head to the right, and hold for 10 to 15 seconds. If you don't feel comfortable lying on your back or getting down on the ground, that very first stretch that we did would kind of be the substitute for this one, where we just had our arms crossed and twist, or if you brought your arm behind you and twisted. That would be a comparable exercise there. Any questions about this page? Any more questions about this page? Okay. So now on the back page, we've got 3 more stretches. The first one that's titled supine hamstring stretch. This is obviously going to be getting the hamstrings. This is one that we're going to be lying on your back. You can have the alternate leg. So I'll stretch my right leg here. You can have the alternate leg either bent up or flat. It's a little, if you have back problems, probably bent up is going to be a little bit easier on your back and more comfortable for you. So I would just recommend utilizing that position. Now I'm going to bring my right leg up. I'm going to hold behind my right leg, and I'm going to try to keep about a 90-degree angle from my right leg to my torso. And then from there, I'm just going to straighten out my knee as far as I can. Now, some of you guys may only be able to get here. Some will be all the way back here. But I'm about neutral right there when I hold this stretch. And I'm going to hold this actively. So I'm not really holding my leg up, but I am fighting this with my quad. So I'm actively stretching my hamstring by activating my quad with this. The other thing I want to point out with this stretch is that I'm trying to keep my toe flexed down as much as I can. It's not just dangling up there or pointing up. It's flexed down like this, and we're going to hold this for about 15 seconds. Now the reason we like to do this, a lot of times, everybody has tight hamstrings, right? Everybody's got tight hamstrings. The reason that a lot of people's hamstrings get tight is because they can't turn them off. We actually can substitute our hamstrings as a lumbar stabilizer, which we don't want to do. The reason I like stretching the hamstring by activating the quad is because we have a system in our body. It's called reciprocal inhibition. So if you activate a muscle that's opposite another muscle, it's going to shut that muscle off. So by activating my quad, it's telling my body to shut this hamstring off. So that's why I like doing this particular stretch on my back when I'm actively stretching my hamstring. Now if you have a yoga strap or a stretch out strap, you can use this. This is just a slight variation. And in this case, this is going to be more of a passive stretch where I'm not activating my quad, but I'm just going to loop this around my foot and then I would just pull my hamstring back. Now I prefer the other way, but if you can't do that, if you feel like you don't have the strength in that quad or you're just not comfortable doing that, this is a slightly easier way to stretch that hamstring, is pulling this back. If you don't have a stretch out strap, I sometimes have patients use a jump rope or even just a beach towel that they wind up and loop around their foot. That always seems to work pretty well.
The rope belt works really well.
Yeah, there you go.
A belt also.
Oh, just a traditional belt would work. Yeah, there's a lot of substitutes for the strap. The middle stretch on here, the supine single knee to chest, this is really for hip flexion, but it'll also pull on the thoracolumbar fascia in the back and kind of promote that lumbar flexion moment a little bit. So this one I probably would keep that alternate leg straight, and then I would grab my knee and my shin and just bring that towards my shoulder as far as I can. You may feel this in your low back, you may feel this in your glutes, or you may even feel this kind of up behind the leg a little bit. And hold this for 10 to 15 seconds. And then switch. You're going to hold that side for 10 to 15 seconds. If you feel pretty comfortable with that exercise, you can actually do both, and you can grab both and try to bring both knees into your chest. You can put that underneath your knees, and then this exercise becomes more of a repetitive movement where you're rolling your knees in and then rolling it back out. And of course the ball would be underneath my feet, but you're rolling in and then rolling out, and rolling in and rolling out. I find that repetitive movement is usually pretty soothing for the lumbar spine. Okay?
When doing that, if you've got knee problems, shouldn't you be holding underneath instead of
Absolutely,
crushing it?
yeah. So if you have knee problems, it may be more comfortable to hold underneath. But it's still an okay exercise to perform as long as it's not hurting the knee. And certainly with the big ball, doing the repeated movement in and out is really good for a patient who might have knee problems with that.